Hi there, I'm Dr. Anthony Dakpala, a radiologist. Let me guess, you've heard of X-rays, CT scans, and ultrasounds, but they all kind of sound the same, right? You might be wondering, why did my doctor order an MRI instead of a CT? What even is a CT? Are they all fancy names for the same thing? Well, you are not alone. Most people get confused by this, and today we are clearing it all up. I'm going to break down the four common scans in a way that actually makes sense with simple examples, real life uses, and a few myths to bust along the way. So let's go. So, what is an X ray? X rays basically are the most basic scans, quick, cheap, and super useful. They use a small amount of radiation to take snapshots of bones and some organs. So think about broken bones, chest infections like pneumonia, tooth problems, fluid or air around your lungs. But they can't show soft tissue very well. So they are not great for these things or things like brain joints or detailed organ checks. Now let's go to a CT scan. What's a CT scan? CT means computed tomography. Sounds techy, right? It's like a super-powered X-ray that takes lots of pictures from different angles and puts them together into a 3D image. So we use CTs for head injuries and strokes, chest pain or lung clots, internal bleeding, abdominal pain, and cancer checks, and as a whole lot of things. The downside for this is that it uses more radiation than an X-ray. So we don't jump to CT unless we really need the level of detail. How about an MRI? MRI stands for magnetic resonance imaging. And no, it doesn't use any radiation at all. Instead, it uses a strong magnet and radio waves to build very detailed images, especially of soft tissues. MRI is perfect for your brain, spine problems, joint injuries like your knee and shoulders, tumors, pelvic organs like the uterus, ovaries, or prostates. However, it is slower. It can take up to 30 or even 45 minutes to do one MRI. Secondly, it's noisy. So for those of you who don't like noise, it may be a problem. And if you have metal implants or pacemakers, we may need to take extra precautions or to avoid it at all costs. Current MRI scans are compatible with a lot of metals, so taking the history of people with metals is very important. How about an ultrasound? Ultrasound uses sound waves and not radiation, and they are totally safe even during pregnancy. It's great for pregnancy scans, gallbladder or kidney pain, pelvic scans like fibroids, ovarian cysts, etc., and for guiding certain procedures like biopsies. But ultrasound can't see through air or bone, so it's not great for things like lungs or brain. And for bigger patients or for deeper organs, the image quality might not be very ideal. So, which scan is better? Honestly, there is no best scan. It depends on what you are looking for, how urgent it is, whether you are pregnant or have metal inside your body. A few quick examples are if you fell or someone fell and hit his head, I would probably suggest that the person should do a CT scan. Or if someone has joint or nerve pain, MRI might be the best for this patient. Or if the person is pregnant, the first thing that will come to my mind is an ultrasound. If you have a chest infection, first imaging would be an X-ray. Or a suspected cancer or trauma, I'll probably go for a CT or MRI. So you see, it depends on what we are looking for. There are a lot of myths out there, so we are going to bust these myths. So the first myth is that all scans show the same things. And the truth is that different scans show different tissues. An MRI might show a brain tumor but may miss a pneumonia completely. The second myth is that MRI is better than CT scan. MRI is great for soft tissue, right? But CT scan is faster and better when we have an emergency, like maybe a stroke, where you need very few, you need to make your diagnosis within a few hours so that maybe some intervention can be done, or maybe a bleed. The third myth is that ultrasounds can see everything. And the truth is that it cannot see everything. It struggles with air and bone. It's amazing for pregnancy, pelvic, and abdominal scans, but it cannot replace MRI or CT scans in some instances. The next myth is that scan prep isn't a big deal. Oh, why should I prepare for a scan? Preparing is everything. If we say drink water, fast, or don't pee, please listen to us. It helps us get the right image. Skip the prep and the scan might be unclear, or worse, you may have to come back at another time. So please take these seriously. So a quick recap of what I've said. X-rays and CTs use radiation. MRI do not use radiation. Ultrasound does not use radiation. X-rays are best for your bone and lungs, and they are very quick. CTs best for organs, trauma, and cancer. And then they take about 5 to 10 minutes, depending on what you are doing. In some instances, however, CT scans can take just a little bit longer, depending on what we are doing. So, if we are doing an IVU, that's an intravenous urogram, we have times that we give certain phases of the CT scan. So, we take breaks in between, and so it may take up to 15 minutes. MRI scans, they are good for the brain, bone, spine, etc. And then they take longer. It takes longer to take. So 30 minutes, 45 minutes, you may still be in the scan machine. And then for ultrasounds, we do pregnancy scans, pelvic scans, or abdominal scans with ultrasound, etc., and other soft tissues. And these are fast. And these are live images that we see. So it's like a real-time diagnosis you are making. So now you know, not all scans are the same. Each one has a specific job, and the doctors choose based on what is safe, accurate, and necessary. In our next episode, we'll tackle something you've probably heard about, contrast dye. Why do they inject that stuff during a scan? Or is it dangerous? Should I be worried? Well, we'll break it down simply as always. Don't forget to comment and subscribe down there. And if someone you know is confused about scans, send this to them. See you in the next episode. Thank you.